Hi, I'm Dr. Roadhouse, and I want to introduce you to my patient Greg. Greg's in our decompression program. He's just about done. And Greg, why don't you just talk about how you were when you first came in, and the tests we did, and then the improvement that you've had, and how you're doing right now.
Sure. Uh, well, I first started having back pain when I was at work, and I still don't know what triggered it or what set it off, but it started getting bad, so I started putting heat pads or a heating pad on the back, which helped as long as the heating pad was on the back. Then once I got it off the back, got worse, and it got to the point where I could barely walk. Getting out of bed was excruciating. Just getting to the sitting position was hard. Getting up from the sitting position was really, really painful. It almost made you scream. Almost made me scream anyway.
Mm-hmm.
And then even once I was upright, I could barely walk. It just hurt any movement at all on the back.
Did it hurt when you were breathing too, or was it okay there?
Usually it's okay when I was breathing,
Mm-hmm.
but you don't want to cough.
Right, yeah.
Cough
Yeah,
hurt a lot.
cough was bad.
Cough was very bad.
Okay.
And I heard about you from my boss. She'd been your patient for years.
Okay.
And when I came in, we were doing your tests and doing the test with the moving the leg up. Well, it nearly caused me to pass out, so I figured you probably there was something wrong there.
We figured out where the problem was.
Yeah. So I went and got an MRI, and I found I had I think it was 3 lower discs
Right.
bulging out,
Mm-hmm.
and I was getting the MRI when your back already hurts. Was
Yeah.
interesting
Not
too.
the most comfortable.
It's hard to wiggle around to get to exactly the right place
Right.
when you can't wiggle.
Right, and then you have to sit still for that whole time. And I know that you were in a lot of pain when you were doing the MRI.
Oh yeah.
But you just had to suck it up and
And
get it done so we could figure out what was wrong. So once we figured out that, got the results from the MRI, then we knew you had 3 bulging discs. And so on the test that we did, we were able to figure out which one was the primary one and which ones, were the minor ones. Yeah. And you could say minor, I meant minor problem, not minor pain.
Yeah.
Because it hurt all over.
Yeah.
So then we started the decompression program, and we focused on that disc. And as I told you, on our table, we use a protractor so that we can angle and set the pull so that the decompression is on that disc. And then once that was done, we moved it to the next one, So now you're doing really well.
Oh, doing really well.
We just talked about how you're feeling, sleeping, getting up and down, moving around.
Yeah.
The regular activities.
Oh, on regular activities, doesn't bother me at all now. No more than if you occasionally you strain yourself a little bit.
Yeah.
But that's not the same pain. Not even the same area.
Yeah.
It's just the muscle pain.
Yeah.
Not like it was.
Yeah.
And I mean, like the first week of the treatments, and especially doing the ice packs and stuff, was tremendously helpful as far as the pain management was going. I mean, it cut it at least in half the first week.
That was nice.
Oh, that was very nice. That was extremely nice, since I had stopped having to go to work for a week.
Right, exactly. Yeah, you weren't able to work, you weren't able to do.
I had a hard time sitting and doing nothing.
Mm-hmm.
So even sleeping hurt a lot.
Mm-hmm.
Well, it hurt a lot if I moved at all.
Mm-hmm.
And you don't sleep very well when you don't move.
Yeah. Well, if you do move, it's going to wake you up because of the pain. So all in all, right now, no limitations. You can do what you want.
No limitations. I can do what I want. Actually, I can bend and get down better than I could before. This all happened.
Well, usually when you have discs, they're brewing, and they're maybe bulging out a little bit. So you start getting some symptoms like we talked about, stiffness, soreness, lack of motion. Your back kind of hurts, but it's not the muscle; it's right at the spine, And then all of a sudden, those were little warning signals, but you didn't know exactly what they were. And then all of a sudden, boom, you had that, and you had the searing pain, and it was just stopping you in your tracks. And so that's when you decide, well, I need to go in and do something. And thank goodness your boss referred you here, because we were able to help her several times over the years. She's had several injuries,
Yeah.
but she's done good. So anyway, if you're having severe back pain or pain going down into the leg, or if you have anything unresolved, the spinal decompression works amazing, and it's a fantastic treatment. And you know that when we did the MRI, said, we're going to have to look and see whether this is a surgical case or a case for non-surgical spinal decompression, and you were a candidate for that, and you've seen the benefits of it right now. So I appreciate you as a patient. And we talked about it was a commitment. It's not covered by insurance, but it's what we had to do, and now you've got your life back.
Oh yeah. And the decompression didn't hurt at all. Even in the worst, even in the worst of the pain, even the first few treatments didn't hurt.
Yeah, that's a good point, because like a lot of people, that they might not know that. And I tell most people that you could, if you were on there long enough, you could sleep. Because there's no pain involved in it, and as you got up, then you can feel a lot better. So that's good.
I mean, even when I was in the worst of the pain to start with, it didn't hurt it.
Yeah.
It actually helped ease it.
Mm-hmm. Yeah.
Which was great.
Any little bit at that point
helps.
And plus it gives you hope, like, I'm not going to be like this the rest of my life.
Yeah, well, I've already been that way for like a week.
Right.
That was enough.
Well, I appreciate you as a patient.
Thank you. I appreciate it. Thank you.